Well, good morning again. This is Dr. Bill White with the American Orthodontic Society, and I want to talk to you today a little about ectopic eruption of teeth in deciduous cases. This is where permanent 6-year molar is coming underneath a deciduous second molar back here at the back. As it gets under there and it starts up, and a lot of times the permanent tooth has these cells that eat away the roots of the baby tooth, and they'll eat a place into the baby tooth, and then they get hung on the enamel. These resorbing cells have no effect on the enamel on the deciduous tooth, but they do on the dentin and the blood supply and everything else. Now, it doesn't kill the tooth, it'll just sit there and the crown will just come out. But let's get into this and let me show you what we did. Now, I want to go through some of the history of doing this. I started doing orthodontics back in 1956, and I had been doing a lot of different things. I was in a little town of Hurst, Texas. There was no pediatric dentistry. They didn't know what they were back then. And there never an old surgeon or anything. You just did everything that came down the pike. You did it. And I had a young town, or a town of young people mostly, and they had a lot of kids, and I had a lot of children in the practice. So let's get on and see what we did here. And let me go over here and get this thing set up for a minute. Get a highlighter. Okay, sorry for the delay, but here is a neat little girl who came in, and I examined her teeth, and I'll go over that with you. I took a Panorex on her, of course. Took every kid coming in, we did a Panorex and checked their teeth for everything we could see. She's opened her mouth, and of course got a little diastema between the anterior teeth, and the laterals were coming in, and well, there's a gap there for them. Just a real sweet child. A little too much vertical dimension of the face. Of course, the child probably was breathing through her mouth to some extent. But here, well, let's look at the models now. I'm going to look at the side, and here is an ectopically erupting tooth. Now, this was back in the early 70s. This tooth right here is the permanent 6-year molar. Let me go over here and get this back into a red era, and I have to get rid of that. All right, we'll erase that, and a red arrow just showing this permanent tooth is kind of hung up under the enamel of the deciduous molar. This is the deciduous molar. The resorptive cells around the follicle of the 6-year molar eat the roots of this tooth away. In other words, the roots of the product came out. That's not a very good drawing there for you, but they would eat the roots away, and then they get caught on the enamel edge right there. I have a tooth that just pulled out one time, or it took out. It had no tissue there, and it just an enamel shell where the enamel had no effect on these resorptive cells. It didn't bother them at all. So let's go on and I'll show you the other side of the mouth. The other side had the same thing, identical. The 6-year molar came in too far this way, and these deciduous teeth, had roots going out like something like this. They're spread out here, and these resorptive cells would eat the roots away, and they'd eat sometime way over in here, and they wouldn't have anything, and the crown of the 6-year molar will get hung on the enamel right here, and if you don't take care of this, in other words, you got to get in here somewhere or another and get it where the 6-year molar will come down in this shape. Then you use this as a space maintainer until this permanent bicuspid that's in this area is able to get into that spot. So I'm going to erase that and go on now. And they're looking at it from this side. They don't look all that bad. They're just not, and it's not this bad. To me, this was a simple, easy thing to do. And I was a general dentist in this little town, and I did every one of these ectopically erupting teeth on kids in that town. As far as I know, I was seeing most all the kids in that town. There was no Pediatrics. There was 1 or 2 in Fort Worth, and of course there were a few in Dallas. They could have gone there, but they didn't. They came to me, and if I didn't do something with it, they didn't go anywhere. So I learned how to do this ectopically erupting tooth. In fact, I didn't even know the name of it was ectopically erupting. This is just a tilted 6-year molar running into a deciduous tooth, and a 6-year molar is permanent tooth, and in the follicle around it, it has cells that can eat away the roots of the deciduous teeth, but it leaves the crown. Now let's get on through this. Just looking at it from the side now, she had lost a tooth here. I think we had something in here, but this 6-year molar is coming in right here, and it's hung up on the enamel of this deciduous second molar. Now, if you leave this alone, it'll eat off the whole root structure and erupt this 6-year molar erupt in down here, and you won't have any room for your second bicuspid to come in here, and you'll have a problem with the one down below too. It'll just mess up the case. And I knew that. We just worked with kids, and I saw this happening, and so we would do something about it. And I want to show you what we early on what we did. All right, here the other side, same thing. 6-year molars up here erupting, and this is the deciduous second molar right there. Now, if you look at it straight on, it's the same problem. Now, she had another little cavity or two in here. We would work that. Sometimes if the tooth was about ready to come out, we'd just fill it with some real heavy zinc oxide neutrophil and take it out, or we could put enamel or put an amalgam in the holes and keep the tooth and get the 6-year molars in place. Now we go on to the next deal here. We did have some stainless steel crown, and I don't like stainless steel crowns. You see that we had lost some room in here. Probably this tooth came out because ectopically erupting 6-year molar. You see the length of this deciduous tooth. Now you see the length of the deciduous stainless steel crown. So already you've lost some length in this side of the teeth. You got to get the teeth in on that with that problem. That probably that ectopic eruption may have had something to do with the loss of that tooth. All right. Now we had to figure out a way, back when we were doing this, that we had no bonding material that was worth much more than just, I could take acrylic and I could come in and etch a tooth like this up in this area and dry it out, wash it out, everything, and etch the tooth. And then I could put a gob of acrylic down in here, and I could build a spring. You had to have something that you could build out of a round wire then. It came around that tooth, came over here, and then this spring you could set it up. In fact, you could actually, in some of the cases, I put more activation on the spring than I could put in the mouth. So I'd pull the spring up some and tie it from this corner to that corner. And then this would be sticking out where I could come in here and bond it in place. Now I could come up and pick this well, of course, we made a little holly appliance, setting in here with a little arm right coming back like this. And the child would have to reach in here and catch this and hook it up here. And they would do that all the time they had this in. But when they took it out, they'd have to undo it and take their deal out, brush their teeth, and put it back in there. And we could correct the ectopic eruption like that. Now, I'll show you the other side of this. Now, here I've got both teeth. We put this little wire in here, and of course, we etched and washed, dried, and then everything else got a good etch on it, and we'd put acrylic over the top of this, or you put the acrylic and then put the wire in there, and the same thing over here. Now, you could do that with a round wire, and you could activate that spring quite a bit, and it wouldn't roll on you in there. If you're doing this in a tube, you need to use a rectangular wire and a rectangular tube for it to go so it won't roll. Now, if you don't know how to bend this wire right here, I'm going to just pull up a white screen here, and I'll show you how to do this. And you got this deciduous tooth. This is permanent tooth. It's sitting there, something like that, and your deciduous tooth would be setting up in here, with roots going out like this, and this would probably be eaten off, but the permanent tooth would be caught on a crack right in there. Now you had to put the wire, by the way, I'm going to show you how to, here you can do this to anybody's teeth. I mean, as long as they're living, don't ever, any dentist that works on people's teeth, and you have a tooth like that, and then over here you've got a tooth that's something like this, and you got to put a bridge in there. You need to move this tooth back and straighten it up so that the bridge would go in place. Don't ever do a bridge on a tilted tooth like this. All in the world you've got to do is just bond a tube on the side of that tooth now, and then you make a wire. You come out of here with this wire, and you drop it down, and you go around like that, and now you run this part off out here, and you push this in here, so you got this wire in here, and now this deal is going down here, and we come out on this side. Now say you got a bicuspid right in here, and maybe another one over there, and bond a wire. Just bond a piece of wire, 1/6 or 1/8 wire, it doesn't matter any kind you bond over there. Put this in, bend it up. You've got this acrylic. You can bond acrylic. You don't even need anything really. And you can bond this to it if you wanted to, and run this wire out and come up on this side of one of the bonds. In other words, you'd run this up here and hook it up here to make it long enough. And now as this tooth straightens up, it'll go back in this direction. The roots are down here in bone. And when you straighten the tooth up, it doesn't straighten up with the roots up here. The crown goes back where the roots are. And so you put this in there, and you can just leave this alone, and it'll straighten that tooth up completely. Now, we're showing you stuff to do today. You can do restorative dentistry with orthodontics. Somebody loses a 6-year molar in here, and the second molar tilts over like that. You can go in and straighten that tooth up completely, right parallel with this tooth right here. See, this may be this has to be a wisdom tooth here. This would probably be a bicuspid, but anyway, you'd have the roots coming down here, and you'd pull this tooth in, and the roots would be parallel with that. So you hook this up here, straighten this tooth up, and now leave this activation in it. Or you can take it out and increase it, or you can take a double optical plier, which has one side of it is a round area, and the other side has a round trough, and you mash this wire down right around here where you put the round part down here and the trough up here. You mash that, and it'll bend this wire down like that, and it won't have any problem picking that tooth up and raising it, moving it back. And you can do this on any body. I've done it on people in their 80s, straightening the teeth up, and you can do this. So I kind of got off from my deal, but just remember that. I hope you can remember that. Now we want this tooth to move out of there. So back then we didn't have the stuff to bond to the side on the side. We could etch a tooth down in the crevice of it like this, and with acrylic, and acrylic would hold it while we upright the tooth and bring it out. So you'd run your wire right over here, and you drop it down, you bend it, maybe 2 rounds, you go down here. If you don't have room, you get in the cheek, you can pull these 2 wires together and tie them with a ligature, and now you can have this going out here where you can bond this in, and now you can take these teeth in front of it, raise this up, and hook it behind one of these deals, because when this tooth straightens up, this is going to move back. When this one moves back, this will have to slide back too. So let's get on here, maybe we'll show this. And to me, this was just a simple, easy way. I've never seen anybody else doing this. I just came up with this myself years and years ago, and have been doing it for years. All right, here we've got this tooth. Here we've got the wire set up. We just made the wire. Go down here, we got the deal in here. This we go down here, we bring it up and hook it onto that deal. It's sticking down there. When the child takes it out, they slip this out and brush their teeth, everything, put it back in, reach down here, it'll be sticking down, and then reach it up and hook it back on the side like that. And that's the way we did them for a while. Now, I was working with a pediatric dentist, Dr. Jerry Laffer, and his associate there. They were just fine pediatric dentists, and sometimes they would go with me on lecture tours, and they knew Dr. Manny Album. I don't know whether the people reading this are going to know about or looking at this and know. Manny Album was a rather famous pediatric dentist up in the Northeast, and he taught both of these gentlemen that I worked with, and Dr. Album wanted to use this, my slides, and I was needing to use them, and I didn't let him have them right at that time. I later would have given them to him. He was a very fine guy, and he was teaching these dentists to do these things. And this is years ago. And the pediatric dentists today, they don't teach them any orthodontics, or very little. Now, here this is in the mouth, and we're going to put this on the tooth. So I had this little Hawley retainer. Now, what gives you the force to move this tooth up and back, it'll back up, is that it pushes this whole thing down toward the palate up here. And you pull that out, you hook these up, and it pushes that down toward up toward the palate, and it will kick these teeth out of there and push them back. And then you can cut it out, they'll drift up against that deciduous second molar right here. All right, let's go through that. Here it is hooked up. Now there's a mirror in the mouth, and you don't see the mirror too much, but there it is, right there, so that you can look straight at this. Here it is over here, but you're looking straight at it. So we bring this down, hook it on here, and as this tooth comes out of there, this hook will slide backward when it does. And all you gotta do is just get this tooth past this place where it's hooked on the enamel of the deciduous tooth, and you can have it here, and it'll come on in place. All right, here it is hooked up on that side. Now this was a lot of extra stuff that we had to do. As soon as you got bonding material where you could do this, all you gotta do is just put a tube up in here and just bond a wire on 3 or 4 of these teeth and put this deal in here. It comes in like this, and then you run it up like this, and then you pull it down, you figure out where you're going to go, and you put a little hook on it, and just drop it down and hook it behind one of the bonds, and then this tooth will come out, it'll move back. I'm going to show you, I've got a case the way we were doing it just a few years ago. We got better bonding material, and we'll show you how to do that. So this gets enough force, though. If it didn't, I could bend this wire down, but you can't bend it too much, or when you took it out, this thing would be sticking up in here in her cheek. So you can't activate it all that much. this way, but when you got it bonded on here, you can activate the heck out of it, and you can move that tooth out of there in a matter of about a couple of months. You can have the ectopic erupting 6-year molar lined up behind, and you tie onto it and slide it forward with the action still in there. All right, let's go on to the next deal here. I'm going to erase that so you can see it. Now this is just a simple little holly. Now here I was, a general dentist. I never saw this on anybody, but I had to figure out a way to get it done. And that's just plain old common sense. It's a thing you depend on sometimes. You could see it on a Pediatric. And don't paint the thing up so terrible and say, well, you know, this has got to be done by somebody that's had 3 additional years learning to do orthodontics should do this. You could teach somebody in 1 or 2 sessions, or just let them learn how to bend the wire like that. So I'm saying that anybody that's working on children's teeth ought to know how to do this, and they ought to do it. Don't see, because this ectopically erupting in 6-year molars happens when the child's about 6 years old, 6 or in that area. Don't wait till they're 12 years old and send them to the orthodontist, because it'll have messed up the mouth, and it's hard to back up those molars after they get way on up in there. It's not all that hard. I can do it, but it's a lot of extra work. You need to do it right when you see it. I mean, as soon as that 6-year molar comes in, or if you're taking a Pediatric, you can see the 6-year molar coming in underneath the edge of the tooth, right like that. All right, let's go there. There, this is. Now the permanent tooth is up in here, and it's kind of up, running into the crown of this deciduous second molar. And that's the little thing. This wire right here would be down here. You brought it down, hooked it right there. All right. Now here, it's same thing. I just shot a hole. Now, by the way, this was in 1976. And from 76, you got 4, and it was 40 years ago. And I taught on this and showed people how to do it all over wherever I went. And people wanted to learn about it. And I had pediatric groups. If Roy Wolf was in St. Louis, and he had a study club there teaching. He had about 150, I guess, pediatric dentists and maybe other dentists. They wanted to came to his lecture. I went up there several times and showed them how we did our pediatric work. And so this is something that's been out there for years. And we're telling somebody, you can't do this. This is so simple. It just tears me up that the pediatric, the head people in there actually don't let the American Orthodontic Society, they don't want them, they won't come in there and teach. I mean, we've got just dozens of pediatric dentists in the American Orthodontic Society. All right, I don't want to get into a big squabble with them, but anyway, it just hurts me that they keep this from people in general. Everybody that messes with kids are going to have this problem right here, and you ought to be able to do it. And it's easier ways than this. Now here, all right, the thing is moved back. This permanent tooth has come down now, and it's touching past this enamel, and you can pull this up and touch it if it's backed up a little much. But it'll come on in the mouth now and come up in the end, and that second deciduous molar is just a space maintainer in there. Here is the other side. The 6-year molars come down the same way. See, this hook was here. It moved back. That tooth was here. It moved this little wire back as the tooth backs up. Pull that back in that direction. Now this is, to me, is simple, easy orthodontics. And if you're a pediatric dentist, we have a lot of things that's complicated that the pediatric dentist can do. But to come and say, you don't know how to do this. So are you going to send this child somewhere else when they're 6 years old and this problem and have an orthodontist look at it? Now what the pediatric dentists are doing, 2 or 3 of them get together and hire an orthodontist, and he stays with them all the time, and I doubt seriously if the people going through orthodontic school get taught how to do this. Now they should. If they don't, they can think how to figure it out, how to get it done. So this is something that ought to be done, because this happens around 6 years of age, somewhere in there. And if you wait till they're 12 or 14, this tooth will be right over, this permanent tooth right here will go down in here, this bicuspid will not have a space to go in, and then you've got to shove the 6-year molar and the second molar and the wisdom tooth all follow that tooth in there, and that frequently is not done. So a lot of kids are they're having to take teeth out in here where they wouldn't have to if they had done it right, if they'd just gone in here and done that. So I beg you, teach the pediatric dentist how to do this and let them do it. And if you're an orthodontist, if you want something to do, there is a ton of adult orthodontics out there that should be done. And I've got a lot of them. I just took everybody that came in with crooked teeth. And we did a lot of adults, even up in, I've gone into 90, but we started some at 80. And the bone moves, the teeth move, the people know what you're doing, they want to do it, and it didn't seem to take any longer on adults, but you got to figure out some little things over there to get it done. So I'm going to say goodbye. I didn't mean to get riled up about it, but that just bothered me that we are not allowing our pediatric dentists to do this. Thank you for watching, and this is Bill Wyatt with the American Orthodontic Society, and I hope you'll watch our videos and sign up with that. Thank you now. Stop.